chance of getting endometrial cancer as a female with PTEN, it's about somewhere between 5 to 20%. And it seems to be a bit lower than what we thought it was. But again, it depends on the population where you're looking at. What we see in hereditary syndromes is that the more families you know, the lower the incidence becomes. That's because the first families that we get to know are the families where the disease is very common. So they show high incidence or prevalence numbers, and then you see the figures going down. The main symptom of endometrial cancer, so a cancer from the inner layer of the uterus, is abnormal bleeding. So if a patient comes with intermenstrual bleeding, that might be a first symptom. Also a heavy menstruation, more bleeding than they are used to, that might be a first symptom of this disease. So every patient that we see is informed about these type of symptoms and that they need to be aware of it. And if they are confronted with these symptoms, that they need to contact us. As a female with a PTEN syndrome, we would normally recommend to undergo surveillance. So that means that a woman comes in at her gynecology office every year, and she will undergo a ultrasound, so a vaginal ultrasound. And we take a biopsy, an endometrial biopsy. Women find these surveillance visits with the biopsies quite uncomfortable. Depends, some are happy to undergo it, but others find it very uncomfortable. What we showed in a recent study that was published last year is that if we looked at our data, so at all our PTEN patients that we see in surveillance, and we take these biopsies without them having any complaints, we saw that in almost 30% of the patients you could pick up a pre-malignancy. So not a cancer, but already abnormal cells of the endometrial layer. And these patients were not coming in with complaints, they just had their regular visits. So in that way you might prevent patients from getting a cancer. Yeah.